Good morning, and thank you for such a warm welcome. Firstly, I'll just make a couple of corrections. I'm not a doctor, I'm a mister. The reference to the 2003 references that Dr. Dong made was actually 2013. But I'm absolutely delighted to be here today. I look forward to hopefully stimulating some of the discussions that you may have later today through my presentation, which is entitled Reframing Elder Abuse. So let's look at some of the headlines. A 17-month-old found abused and neglected inside an outdoor garage with no heating. Female victim suffers broken hip and a man loses all his assets. But if we look at the issues when we take age into account, do we seem to minimise the impact? And are the headlines different? And to a degree, I would say that they are. And just look at the expression on Mickey Rooney's face in 2011 when he made the statement, in my case, I was eventually completely stripped of the ability to make even the most basic decision, where to go or what we can do. Decisions that everyone likes to make. Over the course of time of my daily life, my life became unbearable. And certainly that expression probably is very reminiscent of anyone in an abusive situation. Let's talk about some reports, and we certainly heard some of these statistics yesterday. So every 10 seconds in the United States, a child is being abused. 4 women die every day in the United States from domestic violence. Every second of every day in Delhi, in India, an older person is being abused, mostly in cases related to financial or property matters. If we take the considerations of the United States and some of the statistics we heard yesterday, statistics are very similar to those of child abuse. According to the Bureau of Justice Statistics in 2010, 11 older people were abused every minute of every day. If elder abuse is underreported, as all indicators suggest, do we have a problem? Perhaps, yes, we do. Yet in some way, our own words tend to minimise the severity and impact on older people and society. For example, let's take the word mistreatment. If we look at all the definitions around that particular word, it is to treat badly. However, if we look at the definitions associated with the word abuse, it's a corrupt practice, improper or excessive use of power or treatment. It's a deceitful act. It's language that vilifies, or it's physical maltreatment. Words are very powerful, and I think we need to think about how the importance of words actually plays to the media, the public, and society as a whole. It was interesting to me that 63% of all deaths worldwide in 2010 stem from non-communicable diseases. Interesting in that I look at NDCs and think, NCDs and think about elder abuse. And are there some connections? And I think there are. So, is it chronic? One would perhaps say it is today. Is it non-communicable? Yes. Is it preventable? Yes. Is it a lifestyle disease? Are circumstances of people influencing issues around elder abuse? And it's a situation that's no longer affecting just affluent societies. Certainly elder abuse is felt by people and older people all over the world. Elder abuse risks include economic and social conditions. Certainly all those things could be said for elder abuse. When I was looking at literature around NCDs, one of the statements that I read said this: the rise in prevalence and significance of NCDs is a result of complex interactions between health, economic growth and development, and is strongly associated with universal trends such as ageing and the global population, rapid unplanned urbanisation and globalisation of unhealthy lifestyles. I could suggest that we actually replace NDCs and just use the word elder abuse in that very same statement. And it's very powerful. The rise in prevalence and significance of elder abuse is a result of the complex interactions between health, economic growth and development, and is strongly associated with universal trends such as ageing of the global population, rapid unplanned urbanisation, and globalisation of unhealthy lifestyles. It certainly could be said the same. If we look at the issue of self-neglect in the case of the elder abuse arena, we do need to examine the relationships between influencing the increase and prevalence of NCDs. Every older American has the right to live free from elder abuse and fear of abuse. A lot was mentioned yesterday about prevalence and population ageing. I'm going to just touch on life expectancy and support ratios because I think these are very, very important factors when we start thinking about where do we move forward and what things do we need to be looking at and what are some of the risks. Global life expectancy has increased from 47 years in 1950 to above 65 today, and is projected to be at least 75 by 2050. 28 countries have life expectancy over 80 today, 25 still less than 55. But the interesting thing for me, coming from a family, when I look at my wife and myself, the 8 children between our parents and the number of children we have, which is now halved, and the likelihood of our children actually halving those numbers again, we need to start thinking about elderly support ratios. And it's the number of working age people 15 to 64, which I tend to disagree with, divided by the number of persons 65 and older, and I probably don't need to tell that to anyone. But if we look at North America, which is in 2010, 5, it will be 3 in 2050, and in some countries it's going to be at least lower than 2. So the number of older people increasing dramatically, yet the number of people to support them, whether it's through pensions, finances, or even care services, is going to be reduced. Is this population explosion of older people going to create some further burdens around the issues of abuse? Yesterday we heard a lot about all the different methodologies, frameworks, work that's being undertaken to examine issues of elder abuse. This is another wheel that I came across. Plain language definition of senior abuse was recently developed by the Centre of Research and Education on Violence Against Women and Children at the University of Western Ontario. Toolkits, wheels, pyramids, definitions. We know what it is. Let's do something about it, rather than continually redefining what it is. And I think some examples have been shown when I think about the words yesterday talking about suspicion indexes. Some of the work that's being done with the dental associations in the US. Interestingly, over the last 2 years in Canada, there was a toolkit developed for dental hygienists, which I still haven't seen, but it was developed for dental hygienists, funded by the federal government in Canada, circulated to the Dental Hygienists Associations for dental hygienists to actually be trained to identify the potential of older people at risk of abuse. How many people in this room have seen or heard of that work? And did someone put yes? There's not many. And what concerns me is that there's a growing number of tools, toolkits, suspicion indexes. We had a suspicion index developed in Canada, which was circulated to 23,000 general practitioners. How many people in this room have actually used or looked at that suspicion index? Again, I think there is developments and things happening all over the world, yet somehow we don't capture that information. Where do we capture it? How do we share it, and how do we make it or use it to build on in our own work? And I think it's extremely important that in some way there is an emphasis on greater knowledge sharing of the tools and resources which are available. Governments put a lot of money into research programs, but if you actually ask them, Susan, I'm going to cite your organisation, if Impea asked governments to actually fund a very interactive web portal where such information could be hosted, discussion forums could be met, do you think governments will fund it? I would argue that perhaps they won't. And my question is why? Abuse takes different forms. This is a woman that I met in Cameroon in January. And as everyone would probably agree, she's absolutely beautiful. But she, an amputee above the knee on both legs. In some African countries, there's a custom called widow inheritance, where widows, including older women, are forced to marry and have sex with deceased husbands' siblings, or other persons against their will, to keep matrimonial property within the family. Older widows in some African countries face witchcraft allegations, and it's not uncommon. Death threats by their family members after the death of their husbands. And it really is about trying to grab the inheritance early. Older widows are particularly vulnerable to property grabbing. A study in South Africa found both young and old who have been forced to have unprotected sex are almost 6 times more likely to be infected by HIV and AIDS and they are coerced in many situations. There's been a clear link between violence and the increased risk of HIV infection, especially in some African countries where older women are working as caregivers of those with HIV. Judicial systems, law. I found this very interesting. In March 2011, this young man, otherwise known as the Night Stalker, was sentenced to a minimum of 27 years in prison for a series of rapes and sex assaults against elderly in the UK. People said he was a charmer, a nice guy, regular bloke. He could be charm itself and turn into a monster in a second. 27 years, probably a very appropriate, great sentence. Our office is in a long-term care home in Toronto where a staff member sexually assaulted a 73-year-old demented resident. He got 1 year. So where's the justice? And it really brings me to the issues of dementia. And one would say there isn't enough understanding about dementia to see where they're suffering violence. There's no training to take them seriously. how do we support older people, and particularly women that have dementia, in identifying potentials for abuse? An example in the UK reports a man who has dementia is raping his wife regularly. It's treated as a medical condition and not abuse, as sexual relations between a husband and wife are normal. No one took any action against him. No one offered her any support. Because she was an older woman and his carer, her experience of rape by her husband was just ignored. How many cases of that take place? Let's talk about money. And I think greed, money, banking, how do we deal with the issues of financial abuse? And it was interesting, 2 weeks ago, and made mention of it, 3 weeks ago, we convened a meeting of all the banks in Canada, the financial institutions, including the regulatory bodies, government, the banking ombudsmen, the public guardians, to talk about this very issue. So what did the banks come to talk with us about? And why did they want to come to the table? They clearly see there are issues within the banking industry and the privacy system which limit their abilities to report financial abuse. Some of the things that they are seeing: reverse mortgages on seniors' properties to access equity, add seniors as a guarantor. They're actually selling seniors' homes, accessing seniors' bank accounts, change accounts, change beneficiary designations, and certainly accessing investment. Joint accounts. How many financial advisors do you think would advise older people to set up joint accounts, whether it be with another party or the children? It's probably quite a lot. My advice to older people around joint accounts that have their cognition reasonably intact would be never look at joint accounts. Some of the things that they're finding: joint accounts are typically established to eliminate probate taxes, and I'm going to talk about probate in a little while, for the convenience of the family and for convenience. And they're subject to abuse when joint holders use seniors' money for their own benefit. This was quite a point of discussion, and one that probably resonates around the world. Debit cards, credit cards, established for convenience of family members to look after a senior's needs. However, instead, these cards are being used to purchase goods and services for personal benefit. How many older people in the community, particularly, who have a carer, actually share their card and PIN number with that carer? And it's probably quite high, because they don't want to go into the arrangements around setting up joint accounts or adding new names to accounts. One of the discussions that took place with the banks was, why aren't banks issuing a carer's card? So, which would make it much easier to actually track. So it's still two cards, one account, but they can actually track perhaps where abuse situations are taking place. And of course, there's always the issue of fraud, and it's not uncommon. So there are many challenges that impede the ability to detect abuse within the banking sector. Electronic transfers or transactions are on the rise in Canada, pose a particular challenge in detecting abuse. Many abuses occur without seniors' knowledge or full understanding due to impracticality, incapability, but some occur with seniors' full participation and knowledge. When we consider the emphasis on keeping people at home and in the community, out of institutional care, there is going to be more opportunities, I think, for carers to abuse the power and the trusting relationship that they're in with the people they care for. When I was looking at this presentation, I came across the quote used by Mark Twain, that the only two certainties in life are death and taxes. Now, it did originate from Benjamin Franklin, however, in a letter in 1789 to Jean-Baptiste Leroy. And I was pondering the question as to what would they say today? Are there still only two certainties in life? And I thought about it for a while, and I thought perhaps there's three now. And what it is taxes, death, and more taxes. Perhaps we need to consider the implications of legislation and policy on contributing to the increased prevalence. For example, probate taxes. And I'm using the example of Canada. In some provinces, they charge a straight fee on probate taxes, $400, fairly low. In others, they charge based on a percentage ratio. Now, whereas the percentage ratio is being charged, financial advisors everywhere are telling older people to divest their assets to their children early to avoid probate. And then that creates divisions within families, sibling rivalry, and then coercion and pressure on parents to divest assets to the way that the siblings want the assets to be divested. So we talk about research, we talk about trying to look at the issues after the horse has bolted. I'm wondering whether we ever take the time to look at what policies and legislations actually impact or have the potential to increase the capacity or paucity of elder abuse. And I think it's an area which is very rarely commented on or even looked at. Indulge me for a little while. I want to share a video with you. Some people may have seen this video. Can you press play, please? Hopefully we've got noise. There's no sound. It did work in the hotel last night. It takes a while to load on the... While they're trying to fix this, I'll give a little bit of background. In 2010, Elizabeth Podnicks and I and others looked at how we can actually bring elder abuse issues to youth. How can we get younger people involved and engaged in understanding and creating awareness around elder abuse? This is a video which was produced by a school in Guelph.
This is a song.
Ah, wonderful. Thank you.
For the teenagers and seniors, a reason that we all gotta change our demeanors and realize that there's really nothing in between us. Our minds are warped and that our eyes just deceive us. We're all equal regardless of numbers. We've all got our qualities, our flaws, and our blunders. Especially when times like this are asunder. We've gotta stay tight, bound together as brothers, or mothers, fathers, or daughters, or grandparents, grandchildren. Titles are relevant. Keep caring for the people you love, even the ones you don't know, whether they tower above or they cower below. Just understand kindness is easy to give away. Just understand kindness is easy to give away, and that it doesn't matter because it doesn't change with age. Know that what we're singing is ringing in our song.
Ageism means discrimination against different generations, not being able to connect to people of different ages.
First of all, I think it's a very negative term, and I think it sucks.
It doesn't matter what your area's like, multi-age or not, there's still stereotypes. For example, something teenagers hard to handle. We're always looking for something to break, steal, or dismantle. But it's easy to tell that's not true. We can't be judged from the actions of a few rebels, people whose lives aren't in order. Just like you can't assume all who are older are boring, fragile, deaf, or slow talkers. Don't just think because someone's using a walker that...
I'm trying to do something here.
Are you really? Oh, calculus. Well, we did this a long time ago.
You can't help me with this.
I'm trying to get this hooked up and I just can't do it.
I had problems with this too.
Excuse us. Pardon me. Could you help us find the University Center?
We haven't got a clue where it is.
Phone ringing?
Yeah, I think it is.
There's a party
Let's
tonight?
go this way and see if we
Sweet,
can
when?
find it ourselves.
I guess that's your thing you wanted.
Oh, hi.
Oh, hi. Good morning. Thank you very much.
Have a good day.
Lovely girl. That was nice.
Oh, great. Couple of seniors.
No, that was tomorrow.
The bus leaves in 5 minutes. We have to go.
That gives us lots of time.
Old people.
Do you mind if we join you?
Oh, not at all. Please do. How nice to see some young smiling faces.
Know that we all belong. Know that what we're singing is ringing in our song. And know that when we do good, there's less room for wrong. And know that we're all equal. Yeah, just age strong. Know your worth. Know that every human created on this earth has something.
I highly recommend, if people haven't seen the full video, go to YouTube, you'll find it there. The reason I wanted to show that was, if we are looking at issues of elder abuse after the horse is bolted, how do we get there before it? And it's through people like this, the youth of our generation, younger people. How do we instill in them the understanding and knowledge to actually them help us reduce the instances of elder abuse? Why aren't issues of elder abuse taught in every school, in every course curriculum? It is too late after the horse is bolted to start dealing with the issue. I think we need to be tackling this at a much younger level, and I think youth and school children are well placed to understand issues of elder abuse. They see it. We had schools from across Canada participate in Elder Abuse Awareness Day in 2010, and they produced some absolutely remarkable materials within their school and enjoyed every minute of it. And I think you'll see from that video, both the seniors and the younger people actually enjoyed their time together. I'm going to end on people's rights, older people's rights. And Alex made mention of this yesterday. Talked about the open-ended working group on ageing that was established by the General Assembly in December 2010 to look at the issues of rights. From our point of view, we are saying there's a failure to capture discriminatory practices, prohibit age discrimination. There's gaps in protection, there's lack of clarity, there's inconsistent attention to narrow ranges on rights, and there's a dispersal of standards. Today's conventions, to list a few, recognise the rights of children, women, people with disabilities, yet in a future where, due to population demographics, older people will be the major sector of our society, are we not prepared to respect this sector's needs as we have with other vulnerable population groups protected by conventions? For the IFA, we certainly believe there needs to be a convention on the rights of older people. If you want to learn more about the IFA, please go to our website, and I thank you